Good afternoon, Senator Burr. My name is Nicole Hopkins, and I am a nurse case manager for Duke University Health System. I am a resident of Orange County, North Carolina, and a constituent of yours. I have been a nurse for 5 years and have worked in several clinical areas, including cardiothoracic intensive care, surgical services, and I am currently serving as a nurse case manager at Duke University Health System. I would like to talk to you today about HR 1667. The Dr. Lorna Breen Healthcare Provider Protection Act. The past few years, while COVID has been ravaging our world, healthcare workers, myself included, pressed on, at times putting themselves and their families at risk by caring for patients without proper protective gear. While the majority of the rest of the population was able to confine themselves safely at home and continue working, we continued showing up day after day in less than ideal conditions for months while hospitals and facilities scrambled to find ways to address PPE shortages and to put protocols in place to triage and treat COVID patients. Even after protocols and PPE shortages resolved, healthcare workers continued witnessing unprecedented amounts of sickness and death due to this terrible virus, all the while continuing to carry the burden of worrying about our own families outside of the confines of our jobs. I would argue that being a healthcare worker through a pandemic was stressful both inside and outside of our employment. It is evident by the research that the number of nurses exiting the healthcare field is alarming. The National Center for Biotechnology Information website contains multiple scholarly journal entries that detail the current nursing exodus and the factors behind it. Through my research of articles and entries on this website, I found that surveys conducted of nurses who have left or are planning to leave healthcare have pointed to the pandemic as the reason, citing things like traumatization, continuous stress, and lack of support from their employer throughout the pandemic. These same surveys also discovered that nurses who worked during the pandemic are experiencing a higher prevalence of depression, PTSD, anxiety, sleep disturbances, insomnia, and fear. Not only is this concerning for the nurses who are experiencing these health effects, but it is also concerning to the patients and the remaining nurses in the workforce who will have to suffer because of a healthcare world where short staffing that was already an issue is now even more of an issue. We must do something to support our nurses and healthcare workers who have battled through this pandemic. HR 1667 seeks to establish grants to improve mental and behavioral health as well as prevent burnout among healthcare workers who worked through COVID-19. The bill proposes that the Department of Health and Human Services award grants to allow for proper training of healthcare workers on suicide prevention, other behavioral health issues, and strategies to improve well-being. The grants will also help establish or expand programs to promote mental and behavioral well-being among healthcare providers who worked through COVID-19. Furthermore, the bill would require the Department of Health and Human Services to remove barriers to accessing care and treatment and identify strategies to promote resilience, while the Centers for Disease Control and Prevention would be required to campaign for healthcare providers to seek treatment and support for mental and behavioral health concerns. This is extremely important right now more than ever in a population of workers who has long suffered from the effects of performing the already stressful jobs of caring for sick people. The COVID-19 pandemic only compounded this stress and affirmed the need to make changes to the way we view and support the people who are the backbone of the healthcare world. Thank you for taking time out of your busy schedule to hear what I have to say about this very important issue. I ask that you also provide support to the nurses and healthcare workers who forged through the pandemic caring for patients while risking their own health and the health of their families by co-sponsoring this very important bill.